Welcome, everybody. My name is Melanie Escher, and I'm with the Arizona Telemedicine Program and the Southwest Telehealth Resource Center. And you have joined us today for Changing the Paradigm: Who Tells Our Story Shapes Our Destiny. So today, for the University of Arizona folks, we do have DEI credit. Here is the QR code. If you'd like to go ahead and pull out your phone and take a picture of it. I will put the URL in the chat when I'm done with this as well. And there is one more slide that has the QR code on it that you'll be able to grab as I continue through my introductions here. So again, this is welcome to our series. This is a Improving Access to Quality Medical Care webinar series, and is brought to you by the Arizona Telemedicine Program, Southwest Telehealth Resource Center, the National Reach Coalition, and Mel and Enid Zuckerman College of Public Health. So here at the university, we respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. Welcome, everybody, any other grantees and all of our participants. When you joined, your phone or your computer microphone was muted. We will be using the chat feature. Please go ahead and open that up for any questions that you have for our presenters today. And there will be a post-webinar evaluation survey that it's populated in the back of your screen right now, actually. This session is being recorded and will be available on our website later, and I will put that URL into the chat towards the end of the session. If you have any technical issues, we do have an email, atpwebinar@telemedicine.arizona.edu. You can email us, or there is a phone number, and you can please leave a message if someone doesn't answer it right away. That's the 520-626-6978. You'll be sure to check our website for upcoming webinars. I believe the next one in this series is actually going to be the first week of July, and we are working on getting that set up. So please come back to our website and make sure you look for that for the next one in this series. And again, I will put the URL in the chat for the survey. Again, your opinions are important to us. So here's one more time with the QR code for the University of Arizona College of Medicine, Tucson faculty, residents, fellows, staff. And then I will put the URL in the chat. And what I'm going to do now is I'm going to go ahead and go to our next sheet, and I'm going to turn our mic over to Martha Moore-Monroe, and she will be introducing our panelists. Martha.
Hi, welcome everyone. My name is Martha Monroe. I'm the Vice President of the National Reach Coalition Board of Directors, and I'm also a faculty member at the Mel and Enid Zuckerman College of Public Health. And it is my pleasure to introduce our panelists who have graciously agreed to partner with us on this. So I'm going to open it up and ask them to introduce themselves first. I'll start with Agnes and Nadira, and then Winona, if you would go third, please. Agnes?
Thank you, Martha. So good afternoon, everybody. Agnes Attakai and Shanna Financial Tutsuni Bashin. Kachini Dashi Ada Toba Dashana Basin of Nasha. So I'm Agnes Attakai. I'm Dene, a citizen of the Navajo Nation. I'm currently the Director of Health Disparities Outreach and Prevention Education at the Mel and Enid Zuckerman College of Public Health, and also work with the Wisconsin Center for Native American Health and Family and Community Medicine in the College of Medicine at the University of Arizona. That was a mouthful, but we have to put all to signify where we come from, and that's who I am. I'm a Navajo woman who grew up in Northern Arizona and also California, and glad to be here with this conversation amongst all of us. Thank you.
Nadira?
Gat Nadira Mitchell Yenisha, Nakai Dina and Nishla, Billigana Bashichin, Tilsoni Dishe, Billigana Dishnella. Hello everyone, my name is Nadira Mitchell, and I'm also Navajo, and Agnes is my mom, and I am a natural resources major, emphasizing in wildlife conservation and management at the University of Arizona, and I'm also Miss Native American University of Arizona, and it's great to be here and to be able to be on a panel with my mom. It's pretty cool.
Thanks, Nadira. Winona?
Hamitakiapi, Tanyawachiake, Ampowichak Pichisnewi Demie, Sasito Petuan Ed, Lake Traverse Reservation Key, and Mataha. Greetings from Dakota Territory. I'm coming to you in a really good way. I'm grateful to be here and really honored to be amongst a mother and daughter duo.
Thank you. So we're gonna jump in. I'm honored that you guys agreed to participate today. And so I'm gonna start with some questions, and of course I'll be watching the chat for any questions that might come from the audience. So I'm gonna start with Agnes, and then go ask Nadira and Winona also. Did you find that others were telling your experience of COVID in a way that didn't reflect the experience of your community? So was that story that was being told about how COVID impacted your community being told by people from outside of the community that didn't really reflect the experience that you saw?
So all of us in the United States have been impacted by COVID-19 in one form or another, and Native Americans have been disproportionately impacted. And as you saw during the beginning, there were a lot of news reports, headlines in national news, local news about the devastating impact of COVID on Native communities. And of course, more information regarding how COVID, why it took hold in Native communities. And after that, there was more headlines of people dying at high rates of COVID in Native communities. There was, of course, contributing it to poverty, lack of health insurance, lack of health care, all that. So that was displayed across major newspapers. And that was disturbing in and of itself. But I think also it really did not explain why that there were such high rates of COVID among Native communities. And, highlighting the negativity of it, it was necessary, for public health purposes, but also really didn't highlight, some of the work that Native communities were doing to keep themselves healthy during this time. And those stories started coming out afterwards in local newspapers and social media, in Native stories that were told on YouTube, on Instagram, on Facebook, about folks going back to traditional medicines and traditional healing practices to help protect themselves during this time, and telling stories of what had happened to Native communities during the 1918 flu epidemic that happened and decimated a lot of people, and what lessons were learned there. And that it's a cyclical thing, that when the earth is out of balance, that things happen. And this was a warning to Native folks to go back to traditional ways. And so because of that, a lot of our folks are now going back to looking at traditional medicines, going back to traditional practices, going back to the stories that help, strengthen families and communities. And during this time of COVID, a lot of people spent a lot of time at home and actually renewed those connections to language. They started talking to relatives, and there were online activities where people wanted to learn, particularly like in Navajo. There were a lot of classes, there were a lot of sessions, so people reconnected back to their community and their culture. There was ribbon skirt making workshops. There was all sorts of activities that people were able to do, reconnecting back to culture that was not available. And again, as in all communities, when things happen to our communities, the warrior spirit is initiated, and we had a lot of warriors, health protectors out there who started mutual aid programs to help other communities during this time when resources were not provided to Native communities, like PPE, personal protective equipment, many times is lacking in communities due to bureaucracy, due to the red tape in tribal governments and the federal governmental system. So communities created their own mutual aid programs and started distributing foods, traditional foods, traditional medicines, firewood to families. And so that type of warrior spirit was not really highlighted in national news, in And so those are the stories that were left out. The reasons why our communities survived was by the strength of the health protectors and going back to our traditional ways.
Thanks, Agnes. I'm going to ask Winona the same question, and then Nadira, I'm going to get to you for the youth perspective. Okay. So Winona, would you like to add to that? You want me to repeat the question? Okay. So did your community find that others were telling the story of how COVID was impacting your community in a way that didn't reflect this experience, the community's authentic experience?
Yes, absolutely. I think one thing that I guess I'll begin with is I actually come from a youth background, so youth development, trauma-informed care, and I was working for the tribal education department and the college at the time of the pandemic, that initial onset. So in the following initial response, there was a lot of miscommunication and stories that were coming across that weren't actually highlighting the situations that we were facing here in northeastern South Dakota. There was no voice, and I think that's been inherent in historic presence since time and since first contact. We've been silenced, and it really took on its own form for community members to be able to share what was going on, because we're so drastically far apart. From one point to the other, it could be an hour to a different community. And so we also have a really unique story in that we're the only tribe in South Dakota without our boundaries. And that was an entirely different challenge, and with its own set of barriers and also resilience. So there's some, barriers that we experienced in that way. And even within our own community, the different challenges and being able to try and overcome, how did you put it, health warriors in ways that we were able to really focus on honing in, the aunties that started sewing and making their own masks, and the youth that were receiving those trainings and being able to learn how to do that themselves, and then being able to go out and harvest our medicines to really, we knew what was the first thing that we can do, what was spring and summer we can harvest. And so taking youth out, and then pivoting for me, then I transitioned onto the DARE, which is our COVID response team. So then that was a different experience for me, working specifically as a health advocate and also liaison of different ways. But we were the frontline workers, and we had an entirely different perspective of working with tribal health, behavioral health, IHS health, public health, and we used to have a hospital, a full-on emergency room. However, we no longer have that due to bureaucracy of upgrading our facilities over a decade ago, and having to deal with the emergency room locally and all of the other health inequities that we face there. But
thank you. All right, so Nadira, it's from the youth perspective, right? How do you feel? How would you answer this question? Were other people telling the story of the youth and distorting it?
I think for me, it was a very hard and difficult time. I was a freshman at the University of Arizona, and I was actually on the Navajo Nation doing a service project, helping install solar panels at a chapter house. And that was, when we were at the chapter house, that was when we got the email from the University of Arizona saying, 2 more weeks, of spring break. And we didn't really know what that meant. And then when we were coming back to Tucson, that's when we got the Navajo Nation emergency health alert about COVID. And, it was we didn't really know what was going on. We were kind of scared, just traveling, from the res back to Tucson. And so then when we got back to Tucson, I think everything was so up in the air. Administration was up in the air on what we should do. I was living in a dorm at the time, and I was planning on staying, living at the dorm. But then, I think everyone just started to hear how it was getting more serious. And that's when I decided to move out and then move back in with my parents. And I just feel like there was kind of, everything was just so up in the air and we didn't really know anything. So I think for a lot of younger people, especially college students, you know, we're like a pretty big like majority and like population. And like, just think about everyone who was a student, who was out of state, who was, you know, on campus in a dorm, like from a different state. And, you know, they couldn't find a way back home, and or they had to go back home, even though, you know, maybe their dorm had more resources for them than compared to resources they have at home, like on the reservation. You know, you have your own space usually in your dorm, but, you know, when you, for certain Native students who had to go back home, you know, they're having to possibly, you know, bring back COVID when, you know, they didn't really have anywhere else to go. And I think the youth perspective and the college student perspective was kind of, you know, lacking. And we were just kind of like, didn't really know what to do. We were just kind of like going through the motions of like, oh yeah, like we have to like get out of the dorm or, you know, leave campus. And I was super grateful that my family lives in Tucson, so that, you know, I could just, you know, go back home in Tucson. I didn't have to like travel, but obviously that's not the case for everyone. And it was just super difficult. And in regards to, you know, not having like our perspective is unique as Native people. You know, oftentimes we're one of the only Native students that we interact with on campus or that people know of. And so for me, it felt very isolating being in classes on Zoom, and then, you know, knowing all of the difficulties that people are going through, like on reservations, and, you know, our fellow students not knowing anything about this. And so for me, I actually had the opportunity I was taking a public speaking class. And so the end of the year project was creating persuasive speeches. And I actually, you know, was able to write a speech on how, you know, there should be more congressional funds going to tribal nations because of the pandemic. And at first I wanted to kind of do like a call to action asking for mutual aid from my fellow students in class. But the professor was actually like, no, like students don't have the funds to like help support fellow students. And I was like, I mean, isn't that the point of like, you know, creating a persuasive speech, inspiring your fellow students to help your community? And, you know, the professor was very adamant about, you know, going through a more like having a call to action for students to contact their congressional person instead of, you know, just donating directly. So that was, you know, just like trying to make your voice heard in difficult situations is definitely, you know, hard, but it's definitely something that I learned to do as a student, you know, going through this issue. And not all students had the energy and you know, the energy to do this and, you know, talk about issues while they're also going to school.
Yeah, and especially having a faculty member that was discouraging you from doing that. That must have felt invalidating, right? It must have felt, you know, but at least you have the strength to push back, right? Which a lot of students might not, you know, so that's really, but that's interesting to see from that perspective. All right, so there's one quick question for Winona, then I'll move back to this. So thanks, Nadira. Someone's asking, what does not having specific boundaries mean when you're talking about your nation?
Yes, I apologize for not clarifying that.
Oh, no worries. No worries.
So, it's safe to say that historically, no tribal nation has ever ceded our land. It's always been stolen and we've been forcibly removed. Through our oral traditions, I was raised to understand that our homelands is actually much broader than where we are locally, logistically placed right now. Our ancestors traveled as far as Wisconsin, up into Canada, what is now Minnesota, Nebraska, South Dakota, North Dakota, and Iowa. And it's also, there's a clear historical factor for my people. the United States' largest massacre by hanging was part of the historical presence of what is now Minnesota. The Mankato massacre, it was over 300 that were imprisoned, and then down to 38 plus 2 were hung. And by that Dakota uprising and war, we were forcibly removed and annexed out of what is now Minnesota. That's how they received their statehood. And so the Lake Traverse Reservation is where I'm currently located in, I can't recall what year, but it was during a child, like a CPS child custody case, that the judge ruled through a series of questions just pertaining to, well, how do you use the land, and where does child lived, and things of that nature. They ruled that they abolished our boundaries. So the Lake Traverse Reservation boundaries do not exist in the way that other tribal nations do. And I hope that answers it.
No, thank you for sharing that painful history. So that gets me to the next question, and I'll start with you, Winona, because it kind of ties back in case you want to add anything to that. How has the history of racism distorted your community's story? And then how has that in turn impacted the community's health and well-being? You know, it's really
The dichotomy. No. Well,
you can start with one and then we can morph into the next one.
try and pivot. So how
has the history of racism distorted the community's history? Like, how has it been distorted? Just like what you said about getting rid of the boundaries, how has that distorted the story of and the history of your community? And then I'll get to the second piece. Sorry, I should have broken it up to begin with.
Thank you. So I think one thing that's really safe to say is that there's several tribes that are a part of the IRA, which is Indian Reorganization Act, and the Dawes Act, which became a lot of checkerboard reservations and allotment systems. So we share that history, and at the same time, it's created so many jurisdictional issues, and how do we access agency through local services, state services? How do we as tribal nations even receive the funding to be able to provide those services with a lack of infrastructure? And through that lens, at the same time, we're dealing with everything that was removed forcibly. There's something else that was learned, and through that trauma, we have even our own people don't know our own stories, and that is huge. Even though we have tribal schools, we're still working on that healing and bringing back our cultural identity in a deeper more meaningful way. I think that I was really grateful to have access to language and culture growing up, and at the same time, not at the deeper. What I can say is I can compare it to my Dene relatives. I really envy how between Agnes and Ichepmashi Nadira received what I understand is much more than my own people and myself, because of how much went underground due to historical factors. But with that, specifically related to like within the pandemic, I think that Agnes made a really good point in how those things are coming back up. We're harvesting them again, and we're healing in that way of revitalizing and reconnecting. I definitely share sentiment with Nadira. I was a full-time student as a Dakota language learner through our tribal college at the time. And how do you go from reconnecting to our kinship ways and our spiritual ways on a deeper, meaningful relationship with our language, because our language is spirit. And that's something that not every community has, not every tribal nation has language speakers that are still first language speakers from birth. I myself, I'm a second generation product of the Relocation Act, which was after boarding school, that generation, or after the adoption generation, my Coulee, my grandmother, was relocated to Oakland, California. And that's actually where I grew up in the Bay Area. I returned home in the summers because my mom, my ina really made it a huge priority to keep us connected. But my Coulee, my Sampa Coulee, be like my aunties and my grandmas, they all passed away when my mom was young. So I didn't grow up with any of them. I didn't grow up with the language in the way that my mom was able to. There's a lot of different, layers that add to how we exist and how we are able to understand who we are and have that relationship and who we are with our language and our culture, and really understanding our identity. But I think I've kind of veered off of the question.
No, that's exactly what the question was. This is a discussion. We don't have to go by, strict guidelines. No, but thank you for sharing that. I know it's really painful. And I just want to segue over to Nadira, since you brought up the youth perspective and actually being immersed in that culture and that strong connection between language and resilience and perspective, right? So I want to ask Nadira about how has the history of racism distorted, from your perspective, the community's story, and how has that impacted your connection to language? I'm going to add to that because I like the way that Winona took that. How does that impact? How does your connection to language and culture impact, resilience, and how is that connected back to the history of racism against the Navajo community?
So for me, there's so many factors, I guess, just on how, racism has distorted, our community story. I think my mom can delve a little bit more into that. But just overall, like broadly, just, it's, I grew up in Tucson. I grew up as an urban kid. I didn't grow up on the res. I'd visit family, but, for me, I was born and raised here, and we have our Paswiaki and Tana Optum people that also live here too. But for me, I was one of the only Navajo kids in Tucson, and it was just very isolating, just being, a student, growing up here and being one of the only Native students in class, and you feel invisible. And people, oftentimes people would have their own notions of what a Native American person is and what they look like, what they sound. Obviously, it's riddled with stereotypes. And so oftentimes I'd be like, oh yeah, I'm Native American. And, people be like, oh, you live in a teepee, or they just have very stereotypical views, and wouldn't realize that all, tribal nations here in the United States have their own cultures, language. And so that was very apparent for me just growing up, that people really thought we were like a monolithic people, and that, Native Americans was one group of people, and we all lived in teepees. And so just from my perspective, as being one of the only Native students here growing up, and in my schools, just having to deal with preconceived notions on what your culture is, who you are as a person, and people don't even know that we exist, that we still exist. When people think Native Americans, they think of the past, they think of history, they don't think about what we're doing now, and that we are, I guess, modern, that we're just like everyone else basically too. So I think just the whole racism and just white supremacy has just really distorted people's perspective on us. And there's also another side to that where, people are very obsessed almost with Native American culture, where they almost fetishize you. Also, that's also another thing that is in a part of racism is, I will often get comments being like, oh my gosh, I love Native Americans, or I love Navajo people, but like if you say that about any other, ethnic group, like people don't really say that about any other ethnic group. And, it's just kind of weird. Also, I think is another, on one side, people, don't know you exist. They don't know how modern Native people live day to day. They fetishize you, and they, they talk about how much they love you and their culture and your culture. And then there's also just like the racism where you'll just, if you're like a brown Native person, people will literally just, like view you as dangerous, or, they are more likely to like have violence against them if they're, a dark skinned Native person, just existing. So I think overall, those are like a lot of the themes that just like go, like just, that are a part of racism and white supremacy and that Native people deal with. And the second part of the question is just how does that affect our health and well-being? Obviously, there's so many things, but just, from what I talked about is, people don't know that we exist. And so they don't necessarily, know how we live day to day. And so when I was talking about how, there's not as much electricity and water access on certain reservation communities, people didn't know that, but it's something that, that came up with during the pandemic. And also the internet access part, I had friends who like had to do homework and turn in assignments at McDonald's. They had to drive to McDonald's because they didn't have any Wi-Fi access at home. So there's just so much. And I'm pretty sure my mom can also like talk about, the question also, but that just really came to mind for when I was thinking about this question.
Thanks, Nadira. Thanks for sharing. It's hard to talk about it, right? It's because it's painful. But let me go over to your mom and get her perspective. So Agnes, how did you could share how racism has distorted the Navajo's history and how how that's impacted the health and well-being.
Wow, that's a very packed question.
It is. It's a huge question.
It's very hard to discuss, as the other folks, my sister Winona and my daughter Nadira have mentioned. There's so many things that you can talk about, and when we, as working in public health and teaching, I'm always amazed how students are unaware of the history of Native peoples, Indigenous peoples of this land, and it's always first things I do is I talk about the history of Native peoples in general, the fact that we are the original inhabitants and folks are living on stolen land. The name Arizona comes from a Tohono word meaning Oleshonak. Tucson comes a Tohono word meaning Tucson, below the Black Mountain. So living around, anywhere you go, you're on Native land. So I think most people are unaware of that, and it's not taught history, it's not taught anywhere. So people have these preconceived notions. Even our federal system has those notions, unfortunately. And with the history of our Native people, our Native communities are really linked to the historical discriminatory beliefs and values of the US government and the systems. And because of that, they created policies that sanctioned inequitable, systems of housing, lack of education, employment, healthcare, employment, everything. And so because of those federal policies, we have all these health inequities that we're facing now because our people were forced off of land into reservation systems that lacked, all the necessary things to make a community healthy. So they depended upon rations, which were high fat, high sodium. And so you have high rates of health disparities because people are eating food that's not healthy for them. They're not allowed to hunt or to fish because of policies saying they can't move away from federal governmental land. they're forced into residential and mission boarding schools because, they wanted to assimilate people. And so children were kidnapped and taken away from families for years on end and sent back home expecting, things to be right. Even nowadays, people are still being kidnapped, and trafficked. Native women are trafficked at a high rate. And now here in Arizona, we have Native people being trafficked in order to be placed in behavioral health and sober living.
Good, those messages went through.
So those are some of the challenges we face. And, in our history, especially with Navajo history, even people are unaware of how Navajo have been impacted. The Navajos usually lived across Arizona, New Mexico,
Webinars.
Utah, Colorado.
Yeah, the presenters are talking now for the next hour.
I think Melanie's on. Okay, thank you. So we were, and of course, people lived all over the place. And when people start moving westward and needed land, they started having the military come in. So a lot of first contact with people were militarized systems. Soldiers killing, killing people to remove them from the land, doing slash and burn. So here in Arizona, as I said, on the Navajo Nation, between 1863 and 1866, the U.S. Army, did a slash and burn policy under Kit Carson, where they destroyed, all the crops, all the peaches, all the fruit trees in order to starve people out. And then they start killing the animals again to starve people out. And so because of that, they were able to force 10,000 Navajos to 450 miles to Bosque Redondo, which was an internment camp in New Mexico. And they spent about 2 to 4 years there in an internment camp. And that's where, fry bread came about, because they had flour and lard, and that's what they survived on. It was, poverty food. That was the only thing they ate. And so when they were released, after being starved, disease was rampant and people were dying, they went back onto their homelands, and a reservation was created that prevented them from going anywhere. So because of that system was created, and internment and a system in place, people couldn't move. They couldn't build homes. They didn't have access to water, electricity, and so forth. And the lack of infrastructure really created the system in place to where COVID took hold. Because if you have families that live in one bedroom place, intergeneration with 10 families in one, and one got sick, it was more likely someone else would get sick because they breathe the same air. And if there's not enough water to wash, you were really conservative of how much you used water. So COVID really ran through our communities because of that lack of infrastructure that was created through federal policies. And we had some of the highest rates of people dying from COVID because of that. And people say, well, what are some of the reasons why Native people are dying? It's because of the infrastructure. It's because of the policies that were created by the federal government to really destroy people. But our folks were resilient. Our folks knew how to live off the land. They were able to pivot, do things in a different way, and were able to survive the flu epidemic in 1918, and now they survived COVID. But unfortunately, due to COVID-19, we lost a majority of our elder people. Mm-hmm. The most impacted, the most vulnerable were those 55, 60 and older. And because of years of harsh living, of being susceptible to, lack of nutritious food, and having high rates of chronic diseases, their bodies were just not strong enough to survive COVID. And many times they were shipped out to hospitals far away because our healthcare system did not have, the respiratory equipment to keep people functioning in the local hospital. So they're sent to Tucson and Phoenix. And many of our people died alone in these hospitals because no one was allowed to visit folks. And the only way that people were able to connect was through iPad, through telephone, through video conferencing. And that is, the challenge that we see now. It's really devastating to a lot of people because we have lost our elders, our cultural leaders, our knowledge keepers. But the challenge for us young people nowadays is now we have become the elders, and we have to remember what was taught to us and start teaching our younger people, things that were taught to us. So yeah, in American Indian communities, racism is the root of all our health inequities.
This is so I'm going to ask a question that's sort of it's pivoting on what you're saying, a lot of other questions. And when we first started the series, we had an Indigenous scholar from Canada who's fighting to reclaim their story in the history books, right? For community stories in the history book, and is getting a lot of pushback. And of course, we've heard what's happened in Canada to the Indigenous community and what happened to those children there. It reflects our history here too. So how, and I'm going to start with Winona, and then I'll go counterclockwise again. How how is your community reclaiming the story and pulling back and pushing against these distortions, especially now when on a national scale, people are trying to prevent that representation of tribal communities and other communities of color in history books, essentially getting whitewashed out of history, or that distorted history. How is your community, I'll start with you, how is your community pushing back and reclaiming the story on a national level? Are they? Is that too big a question? Is that too much?
No, I'm in a red state, South Dakota. While working for the Tribal Education Department, we were a part of a major effort to indigenize the education policies within the state. And that, I believe, was a 4 to 6 month process where each tribe had delegates going and really adding to the standards. They reached an end, and at that point, I actually was the end of my time, and I transitioned to the DARE program. Since then, now 2022 into 2023, we're still struggling with that because Governor Noem just went and redacted it without even including any voice from the tribal nations whatsoever. So we're really we're working backwards again. I like to say that the state of South Dakota is behind probably 3 decades in policy and presence and work, and we struggle with racism every day. So as a tribal nation and amongst the other Oceti-Sakowin tribes, there's efforts, and I know that there's been a lot of work to really try and push for that change and challenge it. I don't think that it's been successful. However, within our tribe, within our tribal schools, there's a different effort happening there. I think that because we have, it's a double-edged sword, because we have tribal schools at the same time we're funded by Bureau of Indian Education, we still have to comply. We still have, it's this, how radical do you want to be to challenge the dominance that's happening and challenge the oppressive system that's forcing you to either comply with what standards they want versus how are we creatively, innovatively, putting our own stories in the ways that we're educating our students. And I think it really is different case by educator, because also we struggle with the lack of infrastructure for being able to see workforce development, of having our own tribal members be the educators K through 12. That's a whole other issue in itself. However, I'd like to think that those of us that are really passionate about the work and about our stories being present are doing everything that we can to make sure that they are accessible and definitely in relation to how the young people are accessing information too. So we have a tribal app. Our IT department has worked really hard to really keep educating our tribal leaders to help them understand why these efforts are really important. So we have also Facebook pages, and each of our programs and departments have a Facebook page. We also have our own newspaper. We've had that for, I want to say it's over 50 years old. I can't recall specifically the year that it was formed. I believe it was the late 60s. And we also have a website that's dedicated to our education and news and history. And we also have public information officers that try really hard to get our stories out. It could be better. I think one of the biggest goals that I had during the pandemic was to use, I won't plug what federal programs I wanted to use, but I wanted to use open source resources to be able to do storytelling and story mapping. And unfortunately, we're just too busy responding to COVID that we didn't have the time to do that yet. However, that's still something that I plan on doing. And just really advocating to be engaging and provide these resources to our young people to empower them to understand how to share their own stories as well. But I think we see that in a lot of different avenues now, through TikTok, through Facebook, through the short videos, and through young people being able to really navigate the resources that are available on your phone. Like your phones, like everything's there now. And so you see videos being made, you see different educational pieces being made. It's really inspiring to see. I just can't wait to see more of it.
Nice, thank you. So I'm going to pivot to Nadira and then go back to Agnes. So Nadira, how, like you talked about a little earlier, and it ties back into what Winona was saying about how you wanted to rally your fellow students to support your community around COVID, and specifically raising money, and got shut down a bit. How, are you and your fellow students sort of trying, well, Navajo and the other Native American students making those efforts to reclaim your story and reclaim the narrative and fight back against those distorted, inaccurate histories that have been pushed within the system? What do you guys have anything that you guys are doing right now?
So I want to say that for reclaiming our stories, it's not a new thing. And I think for, Native Americans, we have been reclaiming our stories, day by day, decade by decade, but it's just whether or not the people in power are listening, whether or not the United States government is listening, whether or not it's on the news, whether or not it's on TV. I think about the American Indian movement. I think about AIM and how, they occupied these spaces like Alcatraz and then the Bureau of Indian Affairs. And I didn't even learn about it until I think I graduated high school. And so I think also that silencing by the powers that be is a barrier to, our stories reaching a national level, or, maybe even a level that isn't just within our community. So I think, we've always been reclaiming our stories. It's just whether or not, people have been listening. And so, for me, when I've been trying to advocate for Native students here on campus, and then also just our Tucson area at large, I helped kind of start a student-run organization here on campus called American Indian Student Initiatives. We started my freshman year, and this was the group that we went to the Navajo Nation to help install the solar panels. And so once we came back and everything was online, we started doing webinars on Zoom and talking about environmental justice. And so, but also a lot for that, it's kind of difficult just to get your voice out there also, because whenever you kind of have events, when you're trying to create change or positive impact, it's sometimes usually just the people in your community that are listening, and not necessarily the people who should be really listening and learning. And so that's also, I think, been an issue, or, something that, has been a barrier almost to get your voice heard. But, I think in relation to COVID, I think during the pandemic, when we were all on Zoom with this organization, with American Indian Initiatives, we saw how COVID was affecting our community, and we wanted to, have a direct action. And so we did a mutual aid fund for the Bobby Kibri School District. And we also applied for grants at the University of Arizona, and we raised about $3,000 for the school district because, when we asked them what they needed temperature reading stations, and then also just like basic hygiene supplies for their students. And so we were able to provide those resources for the Bobby Kibri School District, from funds that we raised from our University of Arizona community. And so I think that's also, even when you're trying to get your voice heard, it works sometimes, when you're asking at large and you're advocating for the community, and telling people, how dire a situation is, and asking, for donations. I think, in this situation, we were able to provide, a certain amount of money to this community. So it's definitely hard trying to get your voice heard. But I think, when you try, even just a little, and you have passion, having passion, you can't buy that. It's something that you have to cultivate within yourself. So I don't know. It's a lot to think about, and it's a lot to, go through. But I think as a youth, this is what we should be doing. We should be advocating for our communities and for, people who have put in the work, people who, our previous generation who maybe were a part of AIM, or, wanted to be a part of a movement, but didn't necessarily have the resources, the financial resources to go out there and get their voice heard when they were just trying to put food on the table. So I think us as a younger generation, I think, what Winona was saying, using social media, I think has definitely been an avenue that youth have been utilizing in getting our voices heard. So I don't know, I think as we move on as a society, having different technologies, the possibilities are almost endless, which is also kind of scary. But technology is also like a human created thing, and so it should be used to be serving our communities also. But also AI is kind of scary, and it might also like steal like our culture, so that's also like another thing. But I think just overall, just like even just trying a little to like get your voice heard, the possibilities are endless. And yeah.
So you're just getting it out there, and congratulations on that's, also pushing back on the people that were trying to shut you down when you're doing it, and being successful at it is pretty amazing. So I'm going to pivot to you, Agnes, now, if you want to add anything to this portion.
So that was funny when Nadira mentioned AI and how it's dangerous, can take over. Because I read a lot. So one of the things I've been reading and following are Native American authors who do young adult fiction and science fiction and speculative fiction. And it's very interesting that a lot of folks in that genre have really talked about some of the health disparity and health equity issues people face in a storytelling format that people are able to read. So now you hear a lot about young adult authors now whose books are now making it to mainstream, and people have been reading about Native folks. So, so that's one way that, we're able to retell our narratives is through fiction and nonfiction work. And also we have a whole new crop of young scholars who are developing nonfiction books about health, about how genetics is impacting our community, how health disparities are impacting our community and our language. So there are now more people who are using the academic scholarly way to influence work in an academic setting. And now we have a lot more young people who are getting their masters in PhDs or JDs or MBAs in these fields, and who are now also retelling the narrative in languages that academic scholars can understand, and many times will readily accept, versus coming from a community member. But we also see how a lot of information regarding Native folks is portrayed through media. You still have folks who love watching the John Wayne Westerns, the Westerns of way back when. Even some of our newer Westerns still have the fictional Native person still stuck in the 1800s. But you have Native filmmakers and storytellers who are now developing stories who've hit mainstream and telling the modern and contemporary stories of people. I don't know how many of the folks online who have heard about Reservation Dogs, the series following young people in Oklahoma and, life challenges they face in a very humorous way, and many times using dark humor. You've seen recently Prey, the science fiction movie that's part of the Predator series that involves a young Native woman warrior. So, we're hitting mainstream now with some of these stories about how Native people are so diverse. But I think that's an avenue that folks have been using is, reclaiming the space where they can tell stories and retell stories. And of course, we leave it up to our young people to be creative in doing that, through fashion, through arts, through some of the projects they work on, through murals. So that's a way that people have been reaching out and talking about how health disparities have impacted communities. I think one particular story in general, I'm just going to generalize this particular story, but there was a lady, there was a community in the Northwest area who had asked for assistance because of the high numbers of people being impacted by COVID in that particular community. And so when they received packages from the federal government, they were hoping that they would get PPE. Instead, they received boxes and boxes of body bags. What does that say to a community when they reach out to the federal government that they wanted PPE? Instead, they got body bags. And so this particular person was also very artistic in her community, and she used those body bags to do a creative installation of how COVID had impacted her communities, and made a dress and other objects out of those body bags to showcase, this is the way that we address this.
So, I'm going to tie it back to we've talked a lot about loss and grief, and so we often think of loss and grief and how it's intertwined with mental health. So we'd like to separate the two and discuss loss and grief, and specifically. How did your community, and you've talked about this, how was it affected, and how did you experience it, and how did the community sort of address it? Just thinking about loss and grief. And I'll hit Winona. It's your turn.
I think I really want to step back and acknowledge that we've always been in a state of emergency. And I think that it's really fair to say that that's a good generalization for many of our tribes. Many nations have never recovered from what we experienced from first contact. We're still in that. So I think for the purposes of whether you're looking at this as loss, grief, mental health, holistically, like where is the community at? Remember that piece.
Right.
For I can only speak specifically to Sisseton Wahpeton, and I know that the sentiment is shared across Turtle Island. Our death rate was already significantly high. So when the pandemic occurred, and even in the beginning phase of it, it already exacerbated this where we were already at. The resources, where our people were at, what services we even had. We have, I had the privilege of, when I moved home, becoming a part of the suicide response and working with the federal funding grant opportunities that we had that founded our behavioral health department. And like Queen Agnes had shared, like in the academia world, how many authors that we had coming and really providing the resources through academic perspective of what we're dealing with in the communities. And so the resources that I came home with, I didn't know that I was a part of a bigger study. So the resources as an educator and youth development worker in the Bay Area, I actually came back home and there was a book published that I got 8 months later with the resources that I had been trained in for the last 8-9 years. But that didn't mean that translated to on the ground services to tribal members. We're still lacking that. And so even through the pandemic, our BIA keeps binders of our mortality, like our passing relatives. We went from 1 binder to 3 and we're still there. We have funerals every week. We have funerals 3 or 4 or 5 days a week. I can't even go to funerals every day anymore. It's really hard. And then taking that and knowing that I have the privilege of having different resources and different skills and different tools in my toolbox to take care of myself and my loved ones in comparison to my brothers and sisters that are here that grew up in this community that may not have received the same resources that I did because I had the fortune of living somewhere else and receiving those different tools. So unpacking that, we as a community tried really hard to stay bonded together. We have 6 months of winter, so we don't get to be outside 12 months out of the year. So that's also a, reality check. In the spring, we're still dealing with winter, like really harsh winters, major storms that shut everything down. Our tribal administrative building shuts down several times throughout the year. And working on the emergency response side now, it's severe. So I don't really know a real general way to answer it because our services are not consistent. They didn't even go remote when it would have been nice to see them go remote. Our crisis line / behavioral health line stopped being ran. Who did the people turn to? There was a lot of us that started receiving inbox messages through Facebook because not everybody has phones, not everybody has internet, not everybody has access, and they're really far and few apart. But when families were in crises with their loved ones, with their children, I got calls, I got text messages, I got Facebook messages. Who do we, like, where do we go? What do we do? And we lost a lot. We lost a lot of youth. We lost a lot of our elders. It's something that you can't come back from. It's something that it's just a matter of like, how do you keep helping your community work through complicated grief? How do you approach that in a way where we're really trying to remember to be there for each other and be a good relative in a good way, But there's so much layered trauma and so much layered like stress, toxic stress, and daily, we're all in poverty daily here. The counties that we cover and the numbers that we have, our people are still considered a third world country. And a lot of reservations are that. But I think at the same time that resilience has come in a way where I think they realize that we have the answers that we need within ourselves. We have the medicine within ourselves. We are those walking prayers. And I've been saying that since I was like 16. So to see now other generations younger than myself feel empowered to navigate and to reach out and be good relatives. How do we help? The youth we had last year, we had a pilot crew with our youth through the DARE program, and they didn't firsthand do the first responder things that we did, but at the same time, they helped harvest medicine. They helped prepare those COVID packages. They helped grocery shop or deliver the groceries, and they got to be a part of it. And now this year it's actually being, in a different way, elder assistance is happening because the DARE program is now actually formally shutting down. And there's youth that are actually, they're just a week ago, tribal council passed a motion to provide the resources and the tools for young people to actually continue helping the elders. So we're seeing service learning projects step into really being a part of the strategic planning. I think those are pieces that we're not there yet in the planning, but historically from the beginning, we've always been planners. We've always had everything that we needed, and we've always done everything through survival year round. So it's just a matter of giving everybody the tools that they need and the love that they need to make sure that they can keep on championing whatever they're passionate about in a healthy way, holistically.
Thanks for sharing that, Agnes. And then you made me think about something that I'm going to ask you a question in a minute, all of you. But Agnes, the same question, the loss and grief over the centuries, as Winona said, it's really, COVID just has us shown a bit of a spotlight on what's been happening forever, as Winona mentioned. So how would you answer that question?
I think in terms of grief, people are still grieving, and there are people who were not given a chance to grieve at all. So the challenge was that during COVID, many times, as I said, people died in hospitals alone. And because they were at that time when people died, their bodies were considered biohazards. So even when they were buried, there was a limited amount of people who could be there to see that person off into their next journey. So that really disrupted the ceremonies and practices that people have when a person makes their journey from earth into the spirit world. And many times there's gatherings of family members there to support people. Other activities that happen during that span, whether it's when a person passes, whether they have to be buried really quickly, or whether they're given 4 days, like in our Navajo culture, we're given 4 days. But all that was taken away during this time of COVID, so people were not able to appropriately mourn ceremonially when people passed. And that has really impacted people to this day because they did not see their loved ones have that journey. And they question whether, people are, have made that journey or they're still walking around due to COVID. And because, in many families, COVID struck indiscriminately and took a lot of lives. In my family, within the span of a year and a half, we lost 13 people. So we were constantly, starting just a month before the COVID vaccine was supposed to be rolling out. Starting in December, I had an uncle pass. Another week, it was an aunt and her son, and it was just week after week of people passing. And people were not able to grieve, because once you are making those arrangements, you are just in arrangement mode. You're just making sure everything is done and not given that time to grieve. And it impact is seen in our families right now. People who were unable to grieve appropriately and are still suffering. But folks are now acknowledging that behavioral health, mental health is needed. And so in Navajo, our behavioral health services are seeing that as a necessary need. And so what they've been doing is have been utilizing Facebook and social media to do listening sessions and do sessions where they're able to have their traditional healers who work for Navajo Department of Behavioral Health present stories, oral stories and traditional stories of how people overcame challenges and how things have a purpose, how people can take care of themselves, and that they're available if needed be. And so that was one way that the behavioral health services was able to use social media in order to connect people to resources, not individually, but in a community group setting. So I've been on some of those sessions where they talked about grief and loss in the Navajo perspective, and what we do as people to remember folks, and that things have happened as before, but there's a new way that we need to live our lives. And so just like how people have cancer and then they go through treatment and there's a new normal for them. So for folks who've gone through COVID and through grief, there's a new way. We're not going to go back the way that we were before. It has changed us, and so we need to find a different path and how to negotiate things in a different way. So in our community, it has been substantial in terms of grief and not seeing people, but also connecting back to those traditional stories and traditional healers and behavioral health services who are able to provide the needed services. But again, using art as a way to help address some of the grief and challenges that people face. And so during COVID, my daughter and I learned how to tan sheep hide. And so that was a cultural skill that should have been taught by my aunties who passed during this time. And I would connect with those who are existing and ask, how do we do this? And asking other folks. And so we created a way to be able to tan hides in Tucson as a way to connect and to the teachings of those who passed on. So that was just one way that, that Navajo addressed, but also how we in our family address grief.
Thanks, Agnes. Nadira, is there anything you'd like to add to that from the perspective in terms of loss and grief?
I feel like for all students, it was especially hard. I mean, for me, like I was just on Zoom on the computer literally like every day for like hours on end. And I think like at the start of the pandemic, I was taking like maybe 20-ish credits, or it was a lot. And so for me, for just like our other students, how were people able to grieve when, they're on Zoom all the time and they have school to do, they have assignments, they have exams, during this time, University of Arizona was still going on and society, didn't stop, things were kind of expected to just keep churning while all of this was going on. And I think it's affected everyone, regardless of your background. It's affected everyone just on how, people were dying every day, and, you still had to do assignments, or you still had to put in hours for your work. There's definitely, it's just, society didn't stop, things kept on turning. And I think we're all going to be feeling the effects, and we all feel the effects on, not being able to, I guess, take in all that has happened, and then, once the university considered, going back in person, things just kind of, went back to normal, and you just expected to, just keep doing how things were before. And yeah, I mean, we're still in it right now, I guess, but it's just, I don't know, it's just a lot to think about, and a lot that we've all been through. So for me, I was just doing my schoolwork and my assignments this time. And yeah, so I don't know, we've all just been affected, and we're all just expected to, keep doing school and getting our degrees. So it's definitely been hard.
It's a lot to process, yeah, and on the faculty end too, because we see what you guys are going through. So there's one theme that comes through all of it that I wanted to sort of, and it ties back to reclaiming your stories in terms of that whole process of decolonization, right? Because, it's really that feeling of still being colonized, right? Still being sort of controlled, and reclaiming your stories. What sort of, well, two things. What would you recommend to other communities that are trying to reclaim their story as part of that decolonization? And what would you recommend to other communities? And then what is your community, what are sort of the efforts of decolonization that we're going through right now? Start with Agnes and then go to Winona.
I honestly don't know. I mean, what can you tell a community? When, you should have the community decide for themselves what they want to tell. Because I think one of the things that was overlooked during this time is the fact that, when the vaccine came out, that a lot of American communities were fortunate enough to get the vaccines pretty quickly. And, and a lot of communities had high vaccination rates, 70, 80 to even 100%. Their folks that I work with, the mentality was that you vaccinate not for yourself, but for your community, for your elders, for everybody else. And so, again, it's moving that public health model from being an individual person to the health of the community. So when a community is healthy, people in the community are healthy. And how is it, and for Native communities, how is a community healthy? Is when they are strong and have strong ties to their land, to their customs and to their traditions, that they make effort to ensure that people know who they are, and find creative ways to develop programs to help that. So, you have people now doing immersion programs in their schools, teaching Native languages, teaching some of the history and Native cultural activities. During COVID, there were a large number of communities in Arizona who developed culture camps. Those are still existing now. And so we have young people reconnecting and connecting to, their culture and their community, and to intergenerational people, and also the extended kin network to people who are becoming aunties and uncles and grandparents if they've lost somebody. So again, finding, asking communities to tell their story of what they think success looks like for them in this era. What are they doing in order to create healthy communities? And each will tell a different story. We're at Navajo, they're proud to say that they're reconnecting a lot of young Navajo people to language now. So they have a Navajo language exam that high school students can take in order to prove that they are proficient in the Navajo language. We have a lot of camps now teaching for adults and young people how to do those traditional tasks, traditional foods. Again, connecting and letting people know there is no shame in learning how to do these things. That's just a part of what community does. So I guess it's really a challenging question to see, how to tell communities. Usually communities are really good at telling their own stories, but having those venues or places where they can share those stories. And many times it's at the national conferences, it's on Navajo Twitter, Native Twitter, it's on those social media channels where people can tell their stories. And hopefully, you know, others will listen. That's all I have to add.
Thanks, Agnes. Winona, how would you advise people? Based on.
So I actually wrote a paper on this.
Oh, okay.
Kind of funny. It was pre-pandemic, for sure. So having always been a champion of youth leadership and really always advocating for young people and our young leaders, I've always said, you look at our youth. Like, if you want to see the health in a community, if you want to assess it, you look at our young people. You really look at the young adults and see where they're at. I, once again, can only speak for my community, and with so much love, we have a lot of work to do. We have a lot of healing to do. And I think that even in the darkest time through the pandemic, it was really beautiful, and it still is really beautiful to see how many grassroots efforts have been populating, even though they might not feel like they're grassroots, but coming from a grassroots organizing background, it's there, it's coming. And so I'm really excited to see how we're vitalizing culture and language and arts. We have one nonprofit on our reservation, and we have a lot of other families at Tioshbais that are working on vitalizing our like horse ceremonies, or those relationships with our plant relatives and food sovereignty efforts, and reclaiming our traditional medicines in a different way, and bringing back those songs that we were able to bring back a piece of one of our greater ceremonies that we haven't practiced in I don't know how long. We annually have buffalo kills, and at the same time we haven't had buffalo songs or the buffalo dance before. So this year we were able to do that, and that was something really beautiful. I think that it's really important to see the communities really finding our way back to each other, because there's so many fractured relationships. And just like our teachings, we also lost those ways of traditional peacemaking or restorative conflict resolution. So there's a lot of healing to come in many different ways. I think it's really safe to say within my community, there's a lot of lateral violence. And I've heard it said this, it's called like crabs in a bucket. But also when you go back to colonization, I can't remember who taught me this, but I remember learning that through the Geneva Convention, one of the deciding factors of like effective colonization was once the oppression was recapitulated within the society itself again. So once we begin redoing it to ourselves, then they don't have to do it for us anymore. We're already doing it to each other. And that is something that, we have to break. But we are, I think definitely that power goes right back to the young people, because when you reach them at a younger age, then you give them the tools that they need to thrive and be vibrant and go into any of, the efforts that they want to see. They're going to, whether it's learning the language, or we have really passionate young people that have been focused on storytelling through videos. And it's amazing to see the art and our short storytelling that's happening. There's all kinds of things coming. So I'm excited to see how we can continue to lay the foundation for young people to not only continue to decolonize, but it's also indigenize, right? Reclaiming our indigenous ways in a manner that this is our traditional knowledge. And so for us, I grew up hearing that a lot of our beliefs, practices, culture, our medicine was buried, and now it's coming back. And so how are we unearthing that, and how are we, revitalizing our societies in a way that, we're honoring ourselves and each other again with love.
Thank you. And I could listen to all of you all day, but it's been great. We've only got a couple minutes left. I'm sorry, Nadira, but this has been such a rich conversation. Agnes, thank you for sharing those resources, because that's another direction we want to go in, to start putting resources that our partners recommend on our website. So Nadira, I'm sorry, I only have a couple more minutes. Is there anything that you'd like to add to the general conversation? But thank you. You're good? I want to thank you all for taking the time to share with us and have this conversation. I really enjoyed listening to you all today. And Melanie probably has some last words. And again, thank you, and thank all of the people in the audience too. But you guys were absolutely amazing. So thank you for sharing your opinions and perspectives. And they're getting a lot of thank yous in the chat.
You're getting a lot of thank yous in the chat. Yes, very much so. I've been enjoying this entire series since we've been doing this together, Martha. Ladies, again, thank you for sharing your stories. This has been recorded and it will be available on our website. And I did put the URL in the chat a little while ago. And the QR code, again, for any of those from the University of Arizona for the DEI credit, I will go ahead and put that link right back there in the bottom again. And we do have another session that will be coming up in July. Like I said, we are working on the flyer and working on getting that registration set up, but it will be on July 6th. That is a Thursday. So please keep an eye out for that and be able to register and join us. And with that, it's the end of our time. Again, thank you, ladies, for sharing. And we look forward to seeing you again on another session.
Yeah, thanks. And Winona, it's nice meeting you. Nadira, it's good seeing you in person, not just on Facebook. And Agnes, I'll see you in the office. So yeah, thank you so much. And we'll be in touch. I'd like to keep you guys connected if you'd like to with us as well. All right.
Great. Thank you, everyone.
Bye.
Thank you.